Good morning and welcome to the first People's Health Briefing by Roots Community Health Center. I'm Dr. Noha Abalada. This is my co-host, Dr. Aisha Mays. Today is July 21st. For the past several months, we've all been overwhelmed with COVID-19 data, numbers, recommendations that are changing and often conflicting. And many of us are left asking, how bad is it really? How widespread is it? What can I do about it? As health professionals rooted here in Oakland, serving some of the people that are the most vulnerable to getting and suffering from COVID-19, we are here to give you the information that we think is most important to help you make the decisions and the choices that will keep you, your loved ones, and your community as safe as possible. Our goal is to empower you with our best knowledge and thinking in 15 minutes every Tuesday morning of the week and to answer your most pressing questions. So if you have questions, please submit them in the comments. You can email us at admin@rootsclinic.org or send us a direct message. Now, the first thing I think we all need to realize is that even though this pandemic is global, it looks different depending on where you are. California is different from the rest of the United States. Oakland is different from the rest of Alameda County, and East Oakland is even different from the rest of Oakland. So it's important that we drill down the best we can on the specific local data that we have. So when you hear numbers about the nation or California or even Alameda County, you should be asking yourself, what about where I live? What about where I work? What about where I shop? So the way I'm going to talk about these numbers is the number of cases per 100,000 people. So that way we get an apples to apples comparison of different areas. So if we look at the numbers from this past Saturday, you can see that Alameda County is at 548 cases per 100,000. Oakland is much higher at over 800. Now take a look at our East Oakland zip codes. They're double and even triple the rest of the county. We took a look at these numbers and compared them to about 3 weeks prior. What's just as concerning as the numbers is how fast they're increasing. If you look at the East Oakland zip codes, we're increasing at a very concerning rate. Here in the 94603, we've more than doubled our cases in about 3 weeks' time. So I can't. From this site alone, we've received over 6,000 results and counting, and well over 600 positive results. The vast majority of those are East Oakland residents. Here's what we're learning. In the beginning, the vast majority of cases, over 80%, were from essential workers and their household members. Now, so far in July, less than half are getting it this way, with an increasing percent getting it from traveling and hanging out with family. And there are a lot of choices that we're all having to make these days. One is, should I get tested? You may not need to get tested. If you're sheltering in place, if you are diligent and taking every precaution you can about masking and distancing and you're feeling fine, you may not need a test. Or let's even say that you were exposed. You technically don't have to get a test. We think you should get a test, but instead you could just quarantine yourself. You would stay in your own space for 14 days as well as 3 days without symptoms. You would not leave. You would have everything you need, like food brought to you, and you would wait out your quarantine time, a minimum of 2 weeks. But again, if you're sheltering in place, you're taking all your precautions with masks and distancing, and you're not being exposed by others, then you may not need to get a test. And if you don't need to get a test, don't get a test. When it comes down to it, the main reason to get tested is to know if you need to isolate yourself so that you don't get other people sick. And that is a very good reason. That's actually why we're doing all of this testing that we're doing. So who should get a test? If you have symptoms that might indicate that you have COVID-19, get tested and isolate yourself, at least while you're waiting for the results. And please, at the very least, don't go around anyone who's at risk of doing poorly if they catch COVID-19. If you think you were exposed to someone who has COVID-19, you should also get tested. But if you get exposed to someone today, don't get tested tomorrow. That's too soon. We think the optimal time to get a test is about 5 days after you think you were exposed, or if you get symptoms. Now, what do we mean when we say you were exposed, if you think you were exposed? Our best thinking right now is that exposure means that you were within 6 feet of someone for a minimum of 15 minutes. If you're in an enclosed space with someone, it's even worse. If they sneeze or cough or sing or yell, it's even worse, and they could give it to you from even beyond the 6 feet. So how do you know if someone has COVID? You don't. I don't care how well you know the person. I don't care if you hung out with them before COVID. I don't even care if they're in your family. If they're not in your household and you don't know where they've been going and you don't know what they've been doing, you really don't know. Another way you could be exposed is if you are an essential worker and if you're around the public every day, and especially if you don't have the proper protection, like the proper masks and eyewear. Some of the most common essential workers that we're seeing come back positive are not healthcare workers like you might think. They are working in grocery stores, warehouses, food distribution, construction. Another way you could be exposed is if you were in a congregate living situation. So you lived in a shelter, or if you were recently in jail or in prison, you could have been exposed there, and you should consider getting tested before you go around other people. So for now, the best things we can do are mask, distance, test, isolate. Mask when you're in public. Wear a mask when you're around someone who won't do well if they get COVID. Distance at least 6 feet from anyone you don't live with. If the other person is not wearing a mask, you should back up even further and ask them to put one on. And do not be in an enclosed space with them. Do not go to parties. Do not travel on an airplane unless it's urgent. Do not hang around with those who you don't live with, and isolate if you feel sick and if you think you were exposed to others. And when you're having a hard time wearing a mask, you're having a hard time with the distancing, you want to hang out, you want to party, just ask yourself, how is it going to feel when you have to call everyone that you've been hanging around to tell them that you might have exposed them to a deadly virus? Or even worse, if you feel that you might be responsible for getting someone that you care about sick, or even worse. We speak to folks in these situations on a daily basis, and trust me, it's not a good feeling. Don't put yourself in that situation. And with that, I'm going to pass it off to my co-host, Dr. Aisha Mays.
Hello. I'm Dr. Aisha Mays, the Director of Adolescent and School-Based Services and the Medical Director for our Dream Youth Clinics in the Dreamcatcher and Covenant House Youth Shelters right here in Oakland. I'd like to start by providing some tips and guidance for our young elder loved ones safe as well. I'm going to start off by COVID myth busting. So every week we will address some of the widespread myths around COVID and bust those myths with facts. If you have things that you'd like to know about, information you'd like for us to report on, please submit questions on Facebook, direct message us, or send us an email at admin@rootsclinic.org. So this week's myth: young people are not as susceptible to contracting or suffering from COVID. So now here are the facts. Fact: young persons can contract COVID as easily as anyone else. Another fact: young persons can suffer serious health consequences or even death from COVID, especially if they have other health conditions like diabetes, HIV, asthma, or obesity. We still have a lot to learn about this disease, and young people without any underlying illnesses have died from COVID. We also know it's true that in general, young people who are otherwise healthy are less likely than older people to suffer life-threatening effects of COVID. But we do know that young people are just as likely as anyone else to infect others with COVID without realizing it. So young people who spend time with family members or coworkers or those who are older or may have other underlying health conditions really pose a very real health risk to the safety of others. Young people may have younger friends who have conditions like diabetes or HIV, and they don't even know it. Without taking the proper precautions, you could bring harm to someone that you care about, even if you're able to fight off the virus. So our best advice is mask and distance. Both. Wear a mask and distance. So this graphic shows why masking, distancing, and only interacting with people who have on a mask will protect you and therefore protect the people that you care about. So if you take a look at this graphic, individuals who have COVID and those who don't have COVID. So if we look at our top bar there, so if an individual with COVID is not wearing a mask and they're interacting with someone who does not have COVID, they're very, very high risk of passing. If an individual who has COVID is not wearing a mask and they're interacting with someone who is wearing a mask, there still is a moderate risk of passing on the virus. Look at with both individuals are wearing a mask. If the individual with COVID is wearing a mask, an individual without COVID is not wearing a mask, there is a low risk. So we know the risk is now really decreasing with wearing that mask. If both individuals are wearing a mask, we know it's an extremely low risk, even without distancing. But then the thing I really want everyone to look at is if both individuals are wearing a mask and they are socially distanced, physically distanced at 6 feet, there's no exposure. So that is really tells us why it's so important for everyone to wear a mask. Whether you know that you have COVID or are not sure, it's really important for everyone. So I repeat, mask and distance is the most important thing. And when needed, if you have symptoms or you think you've been exposed, get tested and isolate yourself from others. Now,
Dr. Mays. So my final message to you from the front lines is that right now you have one job to do: stay alive. No one is coming to save us. We have to save ourselves. So we don't want you taking risks. Yet we know that some of you will. So knowing that, here's our best advice one more time. Do not socialize in person, party or hang out, or go to Vegas. Don't do it. I repeat, don't do it. But if you insist, limit who you're with, do it outdoors, wear masks, keep at least 6 feet of distance from one another, do what we're calling BYOE, bring your own everything, and please keep a guest list or a sign-in sheet with everybody's phone numbers just in case you have to call everyone to tell them that somebody got COVID. Do not get on an airplane, especially to a hot spot like Atlanta, Florida, or Texas. Don't do it. I'll say it again, don't do it. If it's not an emergency, don't go. But if you must, remember, you are in an incubator. Act accordingly. Disinfect everything around you. Do not touch your face. Wear an N95 mask the whole time. Wear eye covering. Don't eat or drink. Just wait. Keep your mouth covered. Lastly, don't confine yourself in closed spaces like a room or a car with others outside of your household. Don't do it. I repeat, don't do it. But if you must, everyone should wear a mask, keep your windows open. Ventilation and being outdoors is one of our best tools right now, so please use it. This concludes today's health briefing. Thank you for bearing with us through our technical difficulties. We will get them addressed before next week. Please submit your questions in the comment section, direct message us, or send us an email at admin@rootsclinic.org. We will be more than happy to take up your questions each week. Thank you for watching. Please tune in next Tuesday for the People's Health Briefing.